Today I'd like to show you some tools that will help you get dressed safely after having a hip replacement. When having a hip replacement, there are two main types: the posterior approach, which is performed from behind your hip, and the anterolateral approach, which is performed from the front and the side of your hip. If you've had the anterolateral approach, you may not have specific restrictions from your surgeon. However, it is important to remember not to make any excessive movements that would cause too much stress or pain on your hip. Listen to your body. Nobody knows you better than you do. If you've had the posterior approach, your surgeon will give you 3 specific rules to follow at all times to protect your hip. First, when you're sitting, you want to maintain your chest and your legs in an L shape or at a 90-degree angle. You do not want to bring your knees up to your chest, and you do not want to bend down to the floor. Next, you want to make sure when you're sitting or laying in bed that you are not crossing your legs at the knees or crossing your legs at the ankles. You want to keep some space between your knees. Using a pillow while in bed will help you maintain this position. Finally, you want to make sure that you are moving your body all together. You don't want to twist your leg in any way. You want to make sure that you're keeping your feet forward when turning, moving in small increments so that you're not twisting your leg. Don't let your body leave your leg behind. These precautions may make it difficult to get dressed when putting on socks, pants, and shoes. Luckily, we have some equipment to show you that will help. These 3 tools will become your new best friends after surgery until your doctor tells you that you're allowed to move as you normally would. First, a reacher. It will help you pick things up off the ground as well as put on pants. This is a shoe horn that has a long handle, and it will allow you to put your shoes on and off as well as take off socks. Last, we have a sock aid that will help you put on your socks. First, I'll show you how to use a sock aid. When placing the sock, you want to make sure that the bottom of the sock and the heel are lined up with the closed part and the foam pad. The open part is where the top of the sock will be lined up. You'll take the sock aid, brace it either on your leg or your stomach. You will open the bottom of the sock, place it over the end, and scrunch down. You also want to make sure that when you have the sock on the sock aid, it is pulled up to the knots so that there isn't a tail hanging off the end. You will then take one handle in each hand. You're going to cast out the sock aid, just like a fishing rod, down to the floor in front of your surgical leg. You're going to tighten up the tension, bring it towards your toes, and start to stick them into the sock. You're going to continue to pull on the ropes. Lean back, extend your leg at the knee, and begin to pull it on. The blue foam piece will make sure that the sock stays and goes up your leg. If your sock does not go all the way on your foot, you have another tool that can help. This is a reacher. The reacher has a handle that you will grasp, and it has a mouth with an opening. If you squeeze the handle, the mouth will close. When you let it go, it will release any item that you've picked up or grasped. To adjust your sock, you will bring this down to your foot, grab the top of the sock, and pull it up your leg. When putting on pants, you want to make sure that you're dressing in a specific order. You will always place your surgical leg into the pants first and the good leg in second. When taking pants off, you will take your good leg out first and you'll take out the surgical leg second. First, take the pants and place them flared out on the floor in front of you. Take the reacher and grasp the front of the pant leg on the surgical side. Squeeze the handle, bring the pant leg down to your foot and thread the pants up to your knee. Next, take the reacher and place your good leg into the pants by squeezing the handle, grasping the pants on the non-surgical side, and bringing it down to the floor. Place your good leg into the pants and thread back up to your knees. To stand up, kick your surgical leg out in front of you, extending at the knee. Push up from the chair with your arms. Bring your leg back underneath you, and then begin to hike the pants. When taking pants off, you will first, in standing, push them down to your knees, reach back for the chair, kick out your surgical leg at the knee, and lower yourself down slowly. Take the reacher, grasp the pants in front of your non-surgical leg, and push the pants off of this leg. Next, take the pants off your surgical side by grasping the back or the side of the pants with the reacher and pushing them off your foot. Take the surgical leg out second by grasping the pant leg with the reacher and pushing it off of your foot. To use the long-handled shoehorn, first place your sneakers or shoes onto the ground. If you have regular laces, you can keep them tied, or use elastic laces so you can turn your sneakers into slip-on shoes. First, place the metal end of the shoehorn into the back of the shoe, making sure the curved part is facing the front. Next, place your toes into the shoe. Line up your heel with the curve and slide your heel along the shoehorn until it's in place. To remove the shoe, extend your leg out to maintain your L shape with your body. Place the shoehorn into the back of the shoe behind your heel and push the shoe off of your foot. When taking your socks off, you can use the shoehorn at the red rubber end. Place the shoehorn into the back of the sock by the heel and push it off your heel first onto the floor. You can pick up the sock by using your reacher. You can purchase these tools by going to Amazon and looking for something called a hip kit, and it will include all of these tools. You can also go to a retailer like Walmart, or you can go to a pharmacy like CVS or Walgreens. Remember, these tools are only temporary. Your new best friends will help you get back to doing the things that you need to do and the things that you're looking forward to doing once you heal. Thank you for watching. If you have any questions, please contact the South County Hospital Occupational Therapy Department.